how do I know I'm depressed?
Depression,
In fact,
which-
it is fashionable today to say, okay, I'm depressed.
Unfortunately, some people have been using it in that way. Okay,
Yeah.
definitely, it's not the right thing to do. The one thing is that depression is not very clinical depression or depressive disorder. It's not like fleeting kind of thing. Human emotion is not a stable entity. Sometimes you feel happy, sometimes you feel sad. Okay, it's a normal phenomena.
Yeah.
Just because you're feeling sad for like a moment because of some incident, no, like let's say half an hour you're feeling low, or you're feeling upset for 1 hour, you cannot call that itself to be a depressive disorder or a clinical depression.
Okay.
The first and foremost is that characteristic typical low mood, it is supposed to be pervasive. It should sustain at least for a minimum period of 2 weeks.
How do you know that? Is there a screening or, you know?
There is screening also, but before that, what I say is some of the symptoms, some of the indicators of depression is, one is pervasive low mood. You constantly feel low, no matter what is happening in your external circumstances, whether there is something positive going on, you still constantly tend to feel
So what
low.
is this constant? How long of a period?
At
should I
least
say?
for the sake of diagnosis, guideline states it's about 2 weeks.
2
About
weeks.
2 weeks.
Okay, so
To-
2
to-
weeks.
2 weeks.
I'm sitting there,
Huh.
and nothing makes me happy.
Nothing makes you happy, and lack of pleasure in your previously pleasurable activities. You used to find interest in many things, but right now you're lost interest in all those things. You feel very easily fatigued out, very easily tired,
Right.
lack of concentration, lack of focus, getting very irritated, fidgety, angry,
So,
anxious.
so mostly when I'm if I were in that situation, I would not want to go see somebody also.
Yes, yes.
So how do I know, or that I should at least go and see a psychologist? Because for me it may be like, okay, I'll win this. So is there a screening test or something that
There are
we
screening
can-
tests.
okay.
See, first and foremost is diagnosis of depression. Diagnosis of any psychiatric disorder, including depression, depressive disorders, and other disorders, no, it's mainly based on history, the information what we get from the patient himself, or the family members, or the informant, and your clinical observation. So based on that, you can probably come to a diagnosis of depression, or if you have to make use of any tools, there are certain screening questionnaires
Right.
just to back up your diagnosis, which you have done
So
by
what are
clinical
these
examination.
that,
There are certain screening tools like Hamilton Depression Rating Scale, Beck's
Okay.
Depression Rating Scale. Some of these tools are even available online, where you can go through it.
Right.
Not as accurate,
Yeah, but
because
at least
it's
it gives
at
me
least
an
you'll get
idea
a,
that I need
you'll get you a vague idea that yes, you are troubled. Maybe there's a possibility of you being depressed. So
Right.
kindly go and seek some professional help.
And then there's
So
I think
that's a
PHQ-9
possibility.
as well.
PHQ-9 is generally for your mental health. Okay, there are particular scales which are particularly designed to detect screen
specific.
depression.
Okay.
Okay, as I told you, Hamilton Rating Scale for depression,
Right.
Beck's Depressive Rating Inventory.
Right.
These are some of the scales. Okay, not accurate, but ultimately at least it will benefit you to a certain extent, that it may help you to identify that you are depressed. And one
Right.
possible reason why people, including entrepreneurs, do not want to seek help is stigma. They feel that they have been in this position for a long duration of time. They are a very strong person, but it can happen to anyone. It doesn't mean that a person who is having depression or any other psychiatric illness, they are weak. Any psychiatric illnesses, including depressive disorder, can happen to anyone. No one is immune to
So
it.
basically, the first thing is it is an illness.
It's an
We have to-
illness.
we have to
It's
treat
an
it like
illness,
an
definitely,
illness.
definitely.
And point number 2 is it has nothing to do with your strength.
No, not at all.
It's
Not at all.
it's not
Yes, yes.
okay.